One of the most widely used birth control methods around the world is the intrauterine device, most commonly referred to as the IUD. It is a small, T-shaped device that is placed into the uterus by your healthcare provider during a routine office visit and will provide years of highly effective birth control. There are 2 hormone-releasing IUDs available. The Liletta IUD can prevent pregnancy for up to 6 years. The second option is the Kyleena IUD. It has a lower dose of hormone and is slightly smaller than the Liletta IUD. It can prevent pregnancy for up to 5 years. Your healthcare provider is your best guide to determine the best IUD for you. After insertion of the IUD, spotting or irregular periods are common during the first 3 months. It is important to note that the IUD provides no protection against HIV, AIDS, and other diseases you can catch while engaging in unsafe sex. An IUD may not be right for you if you are pregnant or think you may be pregnant, you want to get pregnant soon, you have pelvic inflammatory disease or have had it within the last 3 months, your uterus shape is not normal, you are at high risk for infection due to IV drug use, leukemia, or HIV/AIDS. You have many sex partners. Testing shows an abnormal pap smear that has not yet been evaluated. Or you have a history of tubal pregnancies, liver disease, or breast cancer. IUD risks may include puncturing of the uterus, cramps and bleeding, feeling dizzy, a small risk of infection in the uterus and tubes for the first 20 days after the IUD is inserted, lighter, irregular, or missing periods, formation of a fluid-filled sac or cyst on your ovary, the uterus expelling or pushing out the IUD, or the rare possibility of getting pregnant. One of the main benefits is that fertility will return after it's removed. Pain or bleeding during periods can be lessened, and the IUD also protects against cancer of the uterus. Insertion of the IUD only takes a few minutes. Your provider will do a pelvic exam. Before insertion, the vagina and cervix will be cleaned with a liquid antiseptic. Then, a plastic tube containing the IUD will be gently placed through your cervix and the tube removed. Lastly, the strings attached to the IUD are trimmed. Strings are used by your healthcare provider to remove the IUD when it is no longer needed. After each period, you may be able to feel the strings that hang from the end of your cervix. Your provider will give you instructions on how to check for the strings. Be sure to make an appointment with your provider for a follow-up visit about 1 month after insertion. After insertion of the IUD, pay attention to symptoms like not being able to feel the IUD strings, feeling you may be pregnant, a fever over 101 degrees Fahrenheit with pain in your lower belly, especially within the first month of insertion of the IUD. Continuation of heavy or irregular periods after the first 3 months of insertion. If you notice any of these symptoms, contact your healthcare provider. Alternatives to an IUD for birth control and heavy periods are also available and should be discussed with your healthcare provider. These may include birth control pills or other hormone-containing pills, NuvaRing, Nexplanon, or Depo-Provera. There are also surgical alternatives for the IUD for heavy periods. These would include options such as endometrial ablation and hysterectomy. Your healthcare provider will help you decide what option is best for you. Whether the IUD or other alternatives are your choice of birth control, Gunderson Health System is happy to answer your questions and provide for your care.